HIV and AIDS. What is HIV? HIV is a very small germ or organism called a virus which people become infected with. It cannot be seen with naked eye, but only under a microscope. HIV only survives and multiplies in body fluids such as sperm, vaginal fluids, breast milk, blood, and saliva. We can only become infected through contact with infected body fluids. The body's natural ability to fight illness is called the immune system. It is the body's defense against infection. HIV attacks the immune system and reduces the body's resistance to all kinds of illness, including flu, diarrhea, pneumonia, TB, and certain cancers. That is why HIV is called the human immunodeficiency virus. HIV eventually makes the body so weak that it cannot fight sickness and so causes death. Usually people die between 5 and 10 years after becoming infected, but some HIV-infected people live longer. What is AIDS? AIDS is the final stage of infection with HIV, and this is what causes a person to die. People with AIDS usually have several different illnesses at the same time. These differ among different people. The word syndromes means that several symptoms occur at the same time. It is used to emphasize that people with AIDS have many signs and symptoms because they suffer from several illnesses at once. AIDS is not actually one disease. AIDS stands for Acquired Immune Deficiency Syndrome. How is HIV spread? HIV is an infectious disease, but there are only certain situations in which people who have the virus can pass it to other people. Sexual intercourse is the most common way through which people become infected because the virus survives in sperm and vaginal fluids. Babies born to mothers with HIV can also become infected just before and during birth or during breastfeeding. Infected blood can spread the virus, for example, if it splashes on broken skin or by friends or family members sharing blades, razors, or toothbrushes. Drug addicts who share needles can infect each other. Although blood used in transfusions is treated against the virus, errors sometimes happen and occasionally blood transfusions may be a cause of infection. What does not spread the virus? You cannot be infected with HIV by sharing a house, desk, chair, office, car, taxi, locker, telephone, cup, fork, plate, mug, toilet, towel, sheets, or clothes with someone who is infected. You cannot be infected with HIV by sharing food, sharing a bath, sharing a swimming pool, or shaking hands with someone who is infected. If you hug or kiss someone with HIV on the lips, you cannot get infected. You cannot infected with HIV by being bitten by a mosquito, bed bug, or tick who has bitten a person with HIV. You cannot be infected with HIV in the course of any normal educational activities which take place in a learning environment. What are the symptoms of HIV? Most people with HIV have no symptoms for a long time. They look and feel just like you and me. Most people with HIV feel well and remain productive in their families and workplaces for between 5 and 8 years after the infection. But some people start showing symptoms quite soon after they are infected. When people with HIV start showing symptoms, it means the disease has progressed to AIDS. So what do people with HIV/AIDS die from? People with HIV/AIDS often die of illnesses such as TB or pneumonia, to which they become more vulnerable because of the virus in their bodies. People who do not have HIV also get these illnesses, but because of HIV, the number of TB and pneumonia cases has greatly increased. These days, because of HIV infection, TB and pneumonia are causing many deaths among young people. 3/4 of people with TB now also have HIV. People may also die from very severe diarrhea and from certain types of cancer, especially blood cancers called lymphomas and a skin cancer called Kaposi sarcoma. Some illnesses, particularly acute pneumonia, can be very quick and sometimes people can die before having the HIV infection confirmed. How can we tell if someone has HIV? The only certain way to tell if someone has HIV is through a blood test. If the test shows we have the virus, we are called HIV positive. But for several weeks or months after a person is infected, the body does not show signs of the infection. This is called the window period. If we take the test during the window period, the result will be negative, even if we are infected. The health authorities do not recommend routine HIV testing because a negative result does not always mean an absence of the infection. We can only be certain about our HIV status if we have the test 6 months after the last occasion that we could have been exposed to the virus, for example, through unsafe sex. Most people who are sexually active do not know whether they are infected with HIV or not. We must behave as though we could become infected or infect others and so protect ourselves and others from harm. What is an HIV test? A small amount of blood is taken from your arm with a needle and syringe, or by pricking your finger and putting the blood on blotting paper. The blood sample is then scientifically examined. The test does not show the virus itself, but it shows the presence of antibodies in the blood. Antibodies indicate that the body is reacting to the presence of the HIV virus and trying to defend the body against it. These antibodies only appear in the blood between 3 and 6 months after the infection. Before you have an HIV test, you should speak with a counselor about the test and what will you do when you hear the result. The results of the test usually takes 2 weeks, but sometimes it is available much sooner, even the same day. The result is private, confidential. You do not have a legal obligation to tell anyone if you are HIV negative or HIV positive. But it is right and necessary to share this information with anyone you have had sex with, and it is best to tell a close family member or a friend who can support you. Can a person pass on the infection when he or she is not sick? Yes, a person can pass on the HIV infection to others at any time after he or she has become infected. This often happens before people realize they have HIV infection and even before an HIV test shows them to be positive. Isn't it best, all the same, to keep away from a person with HIV? No. HIV cannot be transmitted by casual contact, so there is no reason why a person should fear being infected by normal daily interactions with someone who has HIV. Many famous sportsmen and women, film actors, directors, academics, and politicians have all worked effectively for a long time when they had HIV until they became ill. Many citizens who are not famous have done the same. It is cruel and unnecessary to add to people's suffering. It is hard enough facing premature death without being chanted by family, colleagues, and friends. If we reject people who have HIV, they may be forced to try to hide it or pretend they do not have it. In doing so, they put other people at risk. People who are infected must be encouraged to take the necessary precautions against passing on the infection, such as wearing condoms during sex or not breastfeeding their babies. Any of us could get the virus, especially if we are sexually active and act carelessly. We should not treat other people in ways we would not want to be treated ourselves. Is there a cure for HIV or AIDS? There is no cure for HIV or AIDS. Medical researchers in many countries, including South Africa, are working urgently to develop vaccines to prevent HIV infection. But even when a vaccine is developed, it will take several years before it can be thoroughly tested, approved by the proper authorities, and made available on a large scale to the public. Medicines that delay the onset of AIDS-related illnesses can be given to people with HIV, but these are not cures. Unfortunately, they are very expensive. Drug companies are developing cheaper alternatives, but these are not yet generally available. When HIV weakens our immune systems, our bodies are unable to withstand infections like TB and pneumonia. TB can be cured provided the patient takes the right drugs for the right period of time. HIV positive people can take medication to prevent pneumonia. In such ways, people with HIV can be helped to live longer and fuller lives. HIV and AIDS can be prevented. Prevention is the only sure way to defeat HIV and AIDS. We can avoid becoming infected and infecting others by ensuring that we act carefully, considerate, and responsibly at all times, especially in our sexual behavior. The tragedy in our country is that so many people are dying from a disease which is entirely preventable. Why don't we hear of many people dying from HIV/AIDS in our community? Because of the time lapse between infection and death, some areas of the country are only now beginning to experience substantial numbers of adult deaths due to HIV. We may not know what is really going on around us because HIV-infected people often die of familiar diseases like TB or pneumonia. People may not be sure whether a fatal illness was AIDS-related. Often family members may not know or may be unwilling to admit the truth. There is a lot of secrecy surrounding HIV/AIDS. Many people are ashamed or frightened to be HIV positive. They and their families will not talk about it. Because of ignorance and fear, people with HIV/AIDS have faced discrimination in their communities, and some have been killed. Such actions have scared people and prevented them from disclosing their HIV infection. Some people still deny that there is such a disease. Some claim that it is a plot against the black people. In fact, HIV/AIDS is a worldwide epidemic that affects people of every race. How do you know this HIV epidemic isn't exaggerated? Research has shown that certain social conditions make it more likely that the high rates of HIV infection and death from HIV/AIDS will occur. These include poverty, malnutrition, poor sanitation and hygiene, violence, including violent and abusive behavior against women and girls, subordination of women, high youth unemployment, migrant labor, and breakdown of family life, sexual promiscuity, especially by men, sexual activity among teenagers, and high rates of sexually transmitted infections. All these factors are present in South Africa. For several years, the Department of Health has been undertaking anonymous testing of blood taken from pregnant women throughout the country. In 1998, this test showed that 21% of pregnant teenagers, 26% of pregnant women aged 20 to 24, and 27% of women aged 25 to 29 were HIV positive. Since HIV is mostly spread through sex, it is highly likely that the male sexual partners of these women also have HIV. Research undertaken in large South African companies shows high rates of infection among their workers in all grades. Having examined the available data, the United Nations AIDS Program estimates that 1 of every 8 adults in South Africa now has HIV. Research has shown that there is now a problem with HIV/AIDS in every community in the country. Even without the research, most of us know that the disease is claiming many lives, young and old. Many of us have lost family members and neighbors. Many of us are caring for sick relatives. Many of us know that we have HIV ourselves. Living with hope. Most people with HIV are well and will continue to feel well for some years after they have become infected. During this period, adults and children have HIV can live active and productive lives at school, work, and home. People with HIV need support and advice. People who test HIV positive must be encouraged to look forward for several years of normal life. The community around us, and especially the school environment, can be a source of love, care, and support. The challenge for us as educators, with or without HIV, is to enable the school to realize this potential. 8 key messages about preventing HIV. Educators have a unique opportunity to change the course of the epidemic. Since almost every child in the country attends school, educators have a unique opportunity to influence children's ideas about sex and relationships even before they start. By so doing, educators can play a central role in changing the course of the HIV epidemic. With few exceptions, children starting their school careers do not have HIV infection. By the time they leave school, many children have acquired the virus. Many will become infected after leaving school unless they have been helped to adopt safe sexual behavior. Leadership begins at home. Educators are expected to be role models and leaders in the community. By adopting safe and responsible sexual practices ourselves, we can protect ourselves from HIV and help countless others to do the same. Here are 8 key messages about preventing HIV. Have safer sex. The majority of HIV infection occur during sex. To prevent HIV, we must adopt safer sexual practices. There is no other way. The safest sexual practice is to abstain from intercourse until marriage and then to stay faithful to your partner. If you have intercourse, assume that you and your partner may carry the HIV infection. Use a male or a female condom. Have one sexual partner and practice safe sex each time. When it is time to have children, both partners should have HIV tests and get the results before stopping the use of condoms and trying to conceive. Love and trust. The man or a woman who really loves you is the one who takes precautions to make sure you will not catch HIV from him or her by wearing a condom. Having a partner you trust now is not enough to protect you from HIV. Your partner or yourself may have become infected during a previous sexual relationship, even one that ended some time ago. Saying yes, saying no. A man must ask a woman's permission before having sex with her. Any man who forces a woman to have sex when she has said no is a rapist. Rape is a very serious crime. The victim must be taken immediately to a district surgeon or medical facility for examination, counseling, and emergency contraception. The rape must be reported to the police and the victim will be asked to make a statement. The police must provide support and counseling for the victim and investigate every reported case. Avoiding child abuse, run and tell. Educators have a special responsibility to respect and protect the children in their care. Abuse of a child by an educator is particularly horrible because it betrays a task given to educators by the child's parent. It is untrue that if a man has sex with a virgin, especially a little girl, it will cure HIV. There is no cure for HIV. Instead, sex with a girl or a boy child will cause that child untold pain and misery and may infect them with the HIV virus and cut off their life. Children are taught to respect older people, but that does not mean that they must do everything older people tell them to do, especially if it is wrong and makes the child feel uncomfortable. Every child understands that there are nice kinds of physical touching, like a mother's kiss or hug, or holding hands with a friend. There are other kinds of touching that makes them feel uncomfortable. A child should never stay in a situation where they feel uncomfortable. They must be taught to shout for help, run away and ask an adult they trust for help. Children must be taught never to go to the home of a stranger or walk in the street or in the field with a stranger or get in the car of a stranger. They should not do any of these things with someone who makes them to feel uncomfortable or is behaving strangely, even if that person is a relative or well known to them. You don't have to have lots of boyfriends or girlfriends to get HIV. People who have sex with many people are more likely to catch HIV. But HIV does not only affect people who have many partners. If only one partner was infected and did not use the condoms, we could get infected. Many people have caught the virus after having sex just once with a person who was infected with HIV and did not use a condom. People who are faithful to their wives or husbands can catch the virus if their spouse is not faithful to them. Each year, many children and women are infected with HIV when they are raped. Some children acquired HIV from their mothers. Some of these children have lived long enough to attend school. People also become infected through contact with infected blood, such as from contaminated needles, shared razors, or blades. Using a condom will also protect you from STDs, infertility, and unwanted pregnancy. Sexually transmitted diseases, STDs, cause a sore on the penis or vulva, or pus or pain when urinating. Untreated sexually transmitted diseases increase your chance of getting HIV. Do not have sex if you have an STD. Get it treated. Condoms protect you against other sexually transmitted diseases as well as HIV. Sexually transmitted diseases are the most common cause of infertility. By using a condom, you can avoid HIV and other STDs, and you can decide when you want to conceive a child. Condoms can be fun. Many people say that using a condom is like eating a sweet with its wrapper on. Do these experts really know how to use them? Slipping the condom on can become an exciting part of sexual play. Using a condom is a skill like any other. The more often you do it, the better you get. The best sex is when you don't have to worry about catching a deadly disease. Drugs and alcohol. Drugs and alcohol use are also linked to many cases of HIV. Drunk people often forget about using condoms. Men often take advantage of drunk women to get sex, with or without using a condom. The same can happen with drugs. Some addictive drugs like heroin are taken by injection. Many people have caught HIV from sharing injection needles and syringes. Never share a syringe and a needle with another person. Questions educators ask about sexuality education. Talking about sex is against our culture. We all have sex, but many of us have been taught to think of it as immoral, dirty, or embarrassing unless it is practiced within the bonds of marriage. We are not used to talking openly about sex, hearing about sex, or speaking words like penis or vagina or intercourse. We are not used to talking with children about sexual matters. These aspects of our culture that have made us shy about sex were developed in different times. We now have a completely new challenge with HIV. It is a new disease that was not there when our old customs were created. The arrival of HIV means we have to make some changes to our culture, because if we do not make these changes, very large numbers of our young people will die, and we may do so as well. Changing the rules about discussing sex does not mean that our culture will be threatened. There is much more to our culture than codes and practices relating to sex. In fact, culture changes all the time. That is how it survives. Think how many customs have changed in our lifetimes, and our parents' and our grandparents' lifetimes. If we don't control HIV/AIDS, it will destroy our society, and our cultures will be history. We need to adapt our customary attitude towards sex and talking about sex, because the lives of our spouses and partners, our children, and those in our care depend upon it. It shows maturity to talk about sexuality in a straightforward and responsible way. Young people will appreciate our concern for their problems. I won't encourage immorality. Parents have the first responsibility for teaching children what is right and what is wrong, what is acceptable and what is not acceptable. As educators, we have a very strong moral responsibility to help protect the health and lives of children we educate, and give the best possible advice to parents and learners alike. Some of our religious beliefs about sexual morality may make it difficult for us to discuss sex with children, but we cannot expose young people in our care to life-threatening situations when we have information that could save them. It is not true that teaching young people about sex and sexuality makes them promiscuous or immoral. In our society and many other countries, young people are starting to have sex very early, whether we like it or not. Sexuality education that gives knowledge and teaches respect for themselves and others will help them to make wiser decisions about whether or not or how to have sex and keep safe. The threat of HIV does not mean that we have to discard our moral code. A strong and clear moral code was never more necessary, but it should include the obligation to practice sexual self-restraint and respect for the rights of others, especially our sexual partners. It should include the obligation to teach young people the importance of doing the same. A good starting point is to recognize that sexuality enhances life if it is properly directed. Good sexual relationships are not about power. They are not about demanding rights. They are about mutual enjoyment and respect. Teaching in a country where human rights are protected. In South Africa, human rights are protected and guaranteed by the Constitution. Human rights belongs to all people. Rights come with responsibilities. Rights come with responsibility for us all to enjoy our human rights. We must all exercise our responsibilities. The Constitution guarantees the right to freedom of access to information and freedom of conscience, thought, religion, belief, and opinion. The Constitution gives special protection to children's rights. It puts a duty on everyone to act always in the best interest of a child. Children have the right to information about sexual health and HIV prevention. We may discourage learners from having sex, but learners must be given accurate information on safer sex, as they will make their own decisions. This is a constitutional right and our constitutional responsibility as educators. Shouldn't we just tell young people not to have sex? It is good to talk to young men and women about not having sex, but we must also remember that many of them will ignore or not be able to follow this advice. It is easy to forget how important boyfriends and girlfriends were to us when we were teenagers. These relationships are just as important for young people now. They are a source of development and growth, even when they involve difficult choices. Research shows that if we give young people proper information about sex, about the risk associated with sexual activity, and how they can protect themselves, then they are more likely to decide for themselves to delay the start of sexual activity. If they have knowledge and have discussed these questions openly and without fear, they are more likely to practice sex safely when they do begin sexual relationship. Whenever we consider the question of life skills and sexuality education, let us remember that the tens of thousands of our young people have already begun sexual activity and become infected by the HIV virus out of ignorance. Many young people believe that they are safe because they are young. They may think it is mature to take risks. Taking risks with HIV is not manly or cool. It is stupid, and it involves extreme dangers to others. Some young people who know or suspect that they are infected have made the cruel decision to infect others by jackrolling or gang rape. We must face up to what is happening in our society. Just telling young people not to have sex is not the answer, or at best it is only a part of the answer. The HIV/AIDS epidemic shows us that we are dealing with a moral crisis in human relations in our country. We must teach our children and our young people to respect themselves, to respect their fellows, to show special understanding for the rights of girls and women. to join together in a human solidarity to save ourselves and each other. That should be the basis of our morality. Discussion among young people themselves, facilitated by a knowledgeable young person, perhaps someone who is living with HIV, is a very effective form of education about the disease. NGOs doing this type of work should be welcomed in our schools and encouraged to help. Aren't the children too young for this sort of information? From the time they first start school, learners need to have information about HIV/AIDS presented to them in a way which is appropriate to their age in the context of life skills education. Learning programs have been and are being developed for life skills education for all ages, and training is being provided to enable educators to do this. We often forget that most people become aware of sex and want to know about it at a very young age. It is a difficult fact that many children are already sexually active by the age of 12. Many children become aware of HIV/AIDS when they are quite young, since they know people, including parents or siblings, who are ill or have died. The media is full of stories about the epidemic. Children spread information about the epidemic among themselves, whether or not it is accurate or true. The best thing is for educators to be prepared to start providing the correct information about sex and sexuality and HIV and AIDS before children learn incorrect information about these things from their peers. I thank you.